as you can see, can everybody see the slide there? Problem internet usage?
Yeah.
Yeah, so that's what we're going to talk about, and we like to have cases about the topic or something else. But first I have to say that this is my disclosure that Barbara and I are owners of TCH, and we have to confess that.
And Emily Frosch has no conflict, and she should join us soon.
Okay. So here's the case, and Elisa, do you want to read it?
Sure. So we had a young, highly intelligent teenage boy with Asperger's, ADHD, and ODD who spends an inordinate amount of time online video gaming. It has become an addiction. It is a primary means of socializing with friends, whether in separate places or together. It has allowed him to socialize, yet not really communicate. It's difficult to get him to do other activities as all of his friends are, quote-unquote, gaming online, and it has overshadowed most other interests. The parents are at wit's end, and as it has also been a significant impact on his grades. Okay, how do you advise parents to deal with this kind of scenario? It's particularly difficult for these parents who are torn in terms of limiting activity that seems to make their child happier as he feels part of a social network.
So that's a great case. We'll come back to you and ask you more, Elisa, as we go through this and try to be thinking about this kid. And
okay.
How many kids are addicted, and what does it mean, and how would you tell, and is it real? Some of the questions, and so I want to just introduce that, and just what did you learn in medical school about internet addiction? Well, zero. It didn't exist if you went to medical school before the 90s anyway. But it's just to step back and see the dramatic increase in children who are participating with the internet between 1996 and 2001, and now 84% are participating. And the first question about this case is, our whole culture, if you really think about it, are we all addicted? And if you look, it's just hard to believe. 75% of teens have cell phones in the United States now. 88% of them are texting. And it's sort of like that's part of the air they breathe. And if you look at some of the data from the Kaiser family studies, it's hard to imagine the media exposure is now sort of often more than sleep and school. It's their life. There's 4 hours of TV average. This was in 2010. 71% have a TV. It's not just in the daytime, in their bedroom. And how many of them have their cell phones under their pillow when they fall asleep? So this is the culture. Is the whole culture addictive? Is one kind of way of thinking about this that we've immersed ourselves into. And half of teens are sending more than 50 text messages a day, and 60% are still going at it after dark. And then if you look at social networking, 83% are doing some social networking, and it's emailing. Participation rates are probably going down. They're doing it less. Instant messaging. You're all hearing about these apps like Snapchat. You can put some pictures in, and WhatsApp. These are things that disappear. They think they're disappearing, but they actually leave imprints. They don't know that in their messaging. Video chatting with things like Skype or just on their phone. Chatting online games. Virtual worlds where they're avatars that they're manipulating, 35%. They may be writing on a blog, 28%. Using Twitter, 27%. So not only did doctors not get trained in this, adults, parents, tend to be unaware of what their kids are doing. When half of them said they check their social media more than once a day, only 23% of parents knew that. 2/3 of parents have no rules for internet usage. So this is a worldwide issue, and actually it's become even a bigger concern in Asia. And that's when you look at internet, the penetration of internet active usage around the world. Now, there are countries like the Falkland Islands and Iceland that have like 99% of usage. But if you look at that in the population, South Korea has 92% and has a big population, and so they have a big internet addiction concern. They say up to 30% of kids under 18, 2.5 million are at risk of internet addiction. In China, where they may have a little less penetration, but more people, they are really worried about internet addiction and trying to address it. They have 10 to 24 million children who are said to be addicted. So what is internet addiction? Is it real? And it came into parlance in 1996 following a case report about an adult who had symptoms related to internet use that sounded like substance use addiction. There was tolerance, craving, withdrawal, social isolation, neglecting his children, financial problems. He lost his job. He got in trouble with his marriage, and so from that there was some literature that began, and criteria were proposed for internet addiction, and it was proposed as in the DSM-4, and then later there was criteria for pathological gambling, and the notion of an internet addiction disorder was again proposed for DSM-5. Well, the conclusion, and it was very controversial, the conclusion is those words are in DSM-5, but it says more study is needed. We don't know. What we're saying is the experts are not sure whether it's real or not. And one of the issues is some people may want to mute themselves while they're not talking. There's noise. Controversy comes down to that there's really a high level of comorbidity. And there are a wide variety of behavior problems, impulse control problems, and in this study in Korea, they said 86% had something else. So is it something apart from the fact that people with ADHD are more prone to it, and it's a place to go as a result of your comorbidity, or is it something itself? That's the issue. Or in the differential diagnosis of the case presented today, is this a normal teen? And so in our culture now, normal teens, forget internet, friends take a priority over everything else. And you know that they love internet games. What does that look like? What does normal teen look like? Does it look like some parents that they're addicted? Maybe they are. Then there's another term that's come up, and this is called problem internet use. And the basic idea is whether there's addiction or not, the main issue is it's getting in the way of life. And so problem internet use has been defined as risky, excessive, or impulsive in nature, leading to adverse life consequences, specifically physical, emotional, social, or functional impairment. And it's been estimated that 4 to 6% of teens in this country would be qualified as having problem internet use. So we'll be thinking about that also. And, in trying to get some kind of compass on how much is too much, and it's not just about the quantity, but excessive in many studies has been considered to be more than 6 hours of recreational use. So that's a metric that you can keep in mind. So I contend that in order to address a child with problem internet use, it is important to not only know, but to have specific idea in the child how it's helping them. Because, there's a lot about the Internet. We all use it. We all love it and hate it. But, and what I'm going to be talking about are studies, where there are associations. And so Internet use, people say they're using Internet for academic purposes, are kids who have less substance use, greater self-worth, better parent-child relations. And then the Internet could be a positive force in building social skills, making closer bonds to people they already know by having extra amount of contact with them, reducing any social anxiety they might have once they start self-disclosing in this remote way, and boosting their self-esteem when they get positive feedback, when they share something online, and then developing their own identities. It's been a really interesting thing. They do this commenting, liking, and sharing, showing their choices, and these teens now are trying out new versions of themselves online, and they have a chance to sort of gauge what kind of reaction they get to different kinds of identity choices at a sort of a safe distance. So that seems to be something for the good, and they can connect to peers online for social support, and when they do that, it can reduce their stress, and in the positive statistic area, we've got 54% of teens join a group related to a cause. So the Internet is a force of good for sure, and we need to know how and what ways the child that we're concerned about is getting a benefit from it. And I'm going to talk more about that. And it could also, for kids who in school don't have quite enough friends, they feel a little isolated, reaching out, homeschooled kids, socially isolated kids, kids with unusual interests, and that would be like a kid who has Asperger's. Like this case, the kid who has Asperger's may be socially isolated. He may have unusual interests, and the Internet, it may be his way to connect and to have a social life and quite satisfying. Even disability, kids with disabilities can have a social life. And as we think about the positive force and we think about this particular kid, we're talking about, does this kid who was presented with Asperger's, ADHD, ODD, what's the rate of Asperger kids who have substance use? Anybody want to guess? Other addictions. How about smoking? Anybody online want to try to get out the relationship before we get into this addiction? How do kids with Asperger's do with other kinds of addictions? Anybody have an idea about it?
I would assume it would be pretty high just because of the perseverant nature of these kids, but I don't know, maybe like 10, 20%.
Yeah. Well, here's the thing to know about. This is really something. I was just at an international conference this week, and the experts presented this, and then there was a guy with Asperger's who was talking to. It's almost zero.
Really?
The amazing thing is, individuals with Asperger's have an extraordinarily low rate of substance use, of alcohol, and smoking, almost none. And why is that? And these were experts all over. We all know this is true. And the Asperger individual said, well, that's because they don't have a peer group to get them in trouble. But also he said, the guy said, well, additionally, the smoke would bother. We have increased sensibilities, and so we're not going to smoke. But then there's another thing that I think I don't know if it's going to relate to this or not, but kids on the spectrum are either black and white in terms of what's right or wrong. And I found that too. They would say, of course I don't do substances because that's the wrong thing to do. So there is something protecting them. Now, it may not protect them for this particular kid, but as we talk further about, what's good about the internet, and even for young kids, it's amazing how many apps and so many kids who are your ADHD, for example, who are bored with the in the front of their room, can get in and get engaged in Khan Academy version or something that's more like a video game for academic achievement. That's really very exciting that's happening. And then the other part, an advantage, I mean, we're in a world where we're living in a world of the internet, and for kids, young kids to learn about navigating, retrieving, creating content on the internet, becoming a digital citizen, it's called. And there are aspects of internet skills that are going to promote their creativity, self-expression, and that's positive. And you know what? If they have access to the internet, this is a chance to teach them how to be a good digital citizen and what that means, and we'll talk more about that. And also, if people look at some of the internet games, they find that they're playful in nature and they're closely related to offline play, so not all bad. So now the other side of the coin. So what dangers lurk in the world of the internet? And there is a minimum age, legal age for Facebook and all apps is 13 years, and the reason for that is this legislation called COPA, is not because the Congress was worried about them being exposed to stuff. They were worried that when they're online, they're going to take data from them. But by respecting that, all the apps, Chattis also, Facebook also says under 13 you're not supposed to do it. Now, it's not enforced at all, and everyone knows that kids under 13 are participating. So some of the consequences, there are some deadly consequences. Texting and driving kills. And everybody, that word is getting out. It increases the risk of having an accident by 20 times 23. So that word's getting out on that. The word's getting out on cyberbullying in the media. 11% of students reported they were a cyberbully victim, and we've come to understand that when people are out on the internet, they become disinhibited. There's a large audience, and the consequence of anything they say is great because lots of people can take it in, and the words are permanent. They're out there. It's not just lost to one person during recess. So of the kids who were cyberbully victims in one study, 90% did not report it to an adult. Now, this has some mortality associated with it. We hear in the press every once in a while. They're 2 or 3 times more likely to commit suicide. So there are some real deadly consequences, mortality. But then getting into social networking a little further and talking about what's happening to the personality development and social development of our children with this experience, as they're really trading real-life activities with virtual ones. And I pulled some data together here that surprised me, that 28% of kids said they shared information they wouldn't share elsewhere. 25% used a false identity. That's what they do to trick people into saying things. 39% shared information, they regretted it. 26% pretended to be someone else. 20% were engaged in sexting. 73%, under the age of 18, 73% of children are exposed in some way to pornography. So that's the world that they're living in, the virtual world that our kids are living in. We better realize it. And the other part of it is that of being in this virtual world is that they start comparing themselves unfavorably to others, because when people are online in their Facebook profile, they're overly representing positive stuff, and they're not talking a lot about the negative part of themselves, and so they don't. They may take it seriously, and they don't feel like they're shaping up. And the status updates, they're going to brag about risk-taking behaviors, and so it may seem like there's a new norm out there for kids. And there's something now called Facebook depression. I don't know if you've heard that term, but the idea is the more you're out there, the lower your self-esteem gets. There's negative feedback, and you're spending less time with your parents. So now, talking about problem internet use, there is, and I'm going to show you now, of the people who get diagnosed with that, and we're going to talk about further about what are the associations we know. We know about the statistics are in their families, there's a higher parent-teen conflict, there's more habitual alcohol use in siblings, perceived parents' positive attitude toward that. Adolescent substance use is seen in lower family functioning, better peer relationship difficulties, poor academic performance, conduct problems, social isolation, impaired communication skills, lifetime use of tobacco is greater, alcohol, drugs, suicidal thoughts. All those things have been associated within the group that has been defined as problem internet use. So, and there's so many other associations. As I said earlier, the whole issue is this just a symptom of something else, or does it make something new? So ADHD comes to mind, and internet use is related in studies to the severity of ADHD, and even controlling for depression and anxiety. And anxiety itself, are they going to the internet to relieve their anxiety, or does it cause anxiety? It's a two-way street. Depression also, and other psychiatric symptoms are more prevalent. And in adult studies, there are all kinds of associations with a variety of disorders and substance use itself. And then, so is it something else, or you consider your ADHD or depressed patient without thinking about the internet use, but you better find out, because they're more likely to be conversing in chat rooms, playing interactive games, accessing sexual information, involved in violent internet game playing, and also regular aggression. They're less likely to use the internet for educational purposes. And then if they're using the internet greatly, more than 6 hours a day, 18 hours a day can happen, and there are actual physical things that can happen. You get back pain, eye strain, carpal tunnel syndrome, sleep disturbances, anxious feelings, more alcohol, drugs, interpersonal problems, greater number of sexual partners, lower self-worth, poor academic performance. These are associated findings in that group. So how do we decide whether this patient is a problem internet use, addicted? How do we do it? Well, since the symptoms we've said are ubiquitous, teens do not complain of internet use. They're not going to come to you and say, my chief complaint is I'm using the internet too much. So we might, in two stances. One is think about secondary screening. So you want to really go into this if you've got a kid who's already depressed, ADHD, social phobia or hostility, something like that. Or primary screening, all kids. So there are some routine questions that have been recommended. Do you feel overly preoccupied accessing the internet? Do you feel your internet use is excessive? Has it been overly time-consuming, causing you to feel upset or guilty, or having serious problems? So those are some questions. But these guys live online, and we know that teens in general will confess more through a computer than they will face-to-face for questions like these, for all kinds of high-risk questions. So there are screening tools. Now, the screening tools, most of them, there are 13 of them I could find, and most of them have been adapted for the criteria for substance use and pathological gambling. And the more commonly used one, that I'm going to spend a little extra time on, is problematic and risky internet use scale, the pre-use, where the recent U.S. norms, and we have it now. There's another one, and particularly Dr. Kimberly Young has a online presence to help with internet issues. And it's interesting to look at her simple scale here. And when you look at each item, if you get 5 yeses, it's called internet addiction. Do you preoccupy with the internet, think about previous online activity, or anticipate the next session? That's like something called salience, like it's always there. Do you feel the need to use for increasing amounts? That's like tolerance for any kind of addiction. And then have you repeatedly made unsuccessful attempts to control? It's like, has there been a relapse? Do you feel restless, moody, depressed, or irritable when attempting to cut down? Withdrawal. Do you stay online longer than you intended? Loss of control. These are all elements that come from the substance use literature and the thinking about the neurophysiology, neuropathology of addiction. Have you jeopardized and risked a loss of significant relationship? Is there some kind of conflict that you're having over your goals that are educational and the internet? Have you lied to family members, like deception that happens among substance users? And do you use the internet as a way of escaping and like modifying your mood for use by use of the internet, like a substance user might modify their mood and self-medicate with the internet? Well, this is a copy of the scale, and these are all the questions. I think there are 18 questions, the past 6 months. This is one that we are now releasing from Chattis. It has a fail score, and it has some subscales, and it has really good psychometric characteristics. So I'm going to suggest, Dr. Haberman, that you use this scale for your patient to help you think about, not from the parent's point of view, from the kid's point of view, what are their activities? Are they passing or failing? This is going back to your case, that kid with a highly intelligent kid with Asperger's. And the internet could be, we really need to think hard about the positives. Asperger's, there's a group I was in contact this week. They only hire Asperger's to do programming, individuals with Asperger's, because they can get so focused. And this may be his lifeline for career. So we need to think about that. We need to think about the positive things, and but it's having an impact on his grades. So that's the other thing. So I'm suggesting here, excuse me, that we may want to take a similar approach as you would to substance use. That's motivational interview. I don't think you have any choice, to tell you the truth. So you're in a checkup visit, and maybe it doesn't come up at all, and maybe you didn't do a screen. So you might say something, this is the standard thing I say. The internet media is a big part of life for most teens these days. I'd like to review it. Well, if you did the questionnaire, you completed if it's okay with you. And what you will be doing in a motivational interviewing is you're going to be looking very ambivalent. This kid, his grades are slipping. He's a bright kid. He may be not totally comfortable with what he's doing. So we have to start with the reasons that he might find as barriers to change. And so it would be something like, I can see from the questionnaire you completed, your social life seems to depend on connecting online. And you found some video games you really enjoy. We found that. And so we want to say that you really love it. You found great friendships, and it looks like this is something that really makes you happy. If we don't start the conversation like that, the parents don't, we're not going to get anywhere and changing this, helping this child. So once we've connected, I'd say, with the potential barriers, the positives, and we really have to know what is it that draws him there? What kinds of games are there? Is he gambling? Is he on chat lines? What kind of games? Is he staying up late? You know, so many of these kids, they're playing together these online games, and they don't want to disappoint their pals by being the first one to go to sleep. And, for instance, so we need to know some of those details. But then once we do, then we can say, you know, looks like the other part of it, if we know this data, looks like being online, what's the downside? Might be interfering with your sleep and maybe even a distraction in school. What do you think? I know you're hoping to get into a good college. Maybe he is. Maybe he wants to go to engineering school. And you're not satisfied with your performance. And being online so much may be limiting your academic success. What do you think? We're going back and forth, the pros and the cons. Then we're going to assess the readiness. How would you describe your internet habit? How would you think it'd be best to get out of internet use? Is there anything else that you would like to change about your internet use? And otherwise, if they acknowledge a need, what ideas do you have about cutting down? Things like that. Or otherwise, you can say at what point you're going to leave with them. Would you feel how bad does it have to get? That the academic shortcomings, the lack of sleep, are bad enough. How bad would it have to get to want to do something about it? So what kind of treatments are available? There is no widely accepted evidence-based treatment for problem internet use, fortunately. But the idea is that you want to carefully evaluate and assess the comorbid condition. Now, how about medication? There are some studies using Ritalin for ADHD and the internet game addiction that there were significant decreases in a randomized trial in internet use. So this kid has ADHD. I would really be sure we're treating his ADHD well. There's a study using bupropion as well, Wellbutrin in individuals who were depressed, and that cut down on their internet use. And then Lexapro, it was open label, but it's not clear that the placebo group did well. They did well, but the placebo group continued to improve afterwards. CBT. There are studies, and the concepts here are like this. You want to practice doing the opposite. So you identify the patient's pattern of it, and you do neutral activities during that time. You might set external limits. Use external prompts like an alarm clock to prompt it to turn it on. You're setting time limits and preset schedules for use. Reminder cards, negative consequences of internet written down and carried all the time. And you test priorities. Prior to using the internet, that clients should put down priorities of the internet session to make a time limit, avoid unplanned internet surfing. So there was a randomized controlled trial of 56 adolescents, and internet use increased in both groups, the control and not control, but they improved more in the intervention group. So what are we talking about? And I would say this family, this child has a oppositional issue already, and this is the setup for a oppositional parent feeling he's got to stop. Educational future is in jeopardy. The child feeling like his whole social life it could be taken away from his parents, and so collaborative problem solving is like a little bit like motivational interviewing. The family needs to learn how to identify the positive things, have that similar conversation. I see that you love it. You've got friendships. It's been a wonderful thing for you in so many ways. But you want to play. There's this particular game you love, and being clear about that, and being able to talk about the part that's positive, and then say, well, but as your parents, we have an obligation to help you get through school and to provide enough time. Since it's not working for you, we have to help you. So how could we come up with a plan and a family online plan, like an asthma action plan, a family online plan, and chat us. We're thinking about helping you develop those things. And then weekly screen timeouts, the media-free zone, the regular family meetings to discuss how the plan is working. So that's it. With younger kids, it's recommended that you co-view and co-play some of these to get an idea what's going on, so you can comment on it. There are this site, and I recommend it to the parents of Dr. Haberman's child, Common Sense, www.commonsensemedia.org. It is wonderful. This site has got everything that you would want in terms of conversations with families, schools, what media, what educational videos are good. It's a fantastic site. I really recommend it. And you can there are sites and you can put controls to actually limit the number of words that said in these sites, and toning down the cyberbullying and inappropriate contacts. And then everyone says when kids are young and when they get older, if you haven't done it, it's hard to start with your teenager, but you want to friend your child, social networking, and have other family members do it. So the idea here is that the child remembers that what they're publishing isn't just for their peers. It can be seen by everyone, including future colleges and employers. And engaging in alternative real-life social interaction, getting in activities, talking about online risks, asking direct cyberbullying, cautioning them about predators, reminding them that everything they hear is not true, younger kids especially. Family therapy may be needed for this child, this team that we're talking about, to improve communication and monitoring approaches. There's some data on it. And then there's some data on the nagging mother, maternal media monitoring, saying no with conviction. You have to stop enabling your child by being a silent partner. There are other management options. There are some online tools. They usually follow a 12-step program. There's some very intense, and I said Asia is really into this. They've got some military-style residential treatment centers. I found there's one residential treatment center in the state of Washington for internet only, but some of the substance-using ones recognize it for really desperate cases. In summary, at every checkup visit, you should take a media history. That includes how much media access in the bedroom. We should discourage access for teens. You might want to think of the HEADS mnemonic, and the A in HEADS is for activities, and that should be your review of the internet use. I mean, I don't know how you talk to teens today without being able to understand what they're doing on the internet, because that's most of their life. If you don't get into it, you're missing what they're about. And And then certainly if the kid has any school problems or mental health issues, that you have to dig into it. Anticipatory guidance, what's their media diet? Certainly discouraging screens in bedrooms. Focusing on the whole idea is, how's the kid functioning? If this kid his schoolwork is sliding, that's an issue where we have to, as parents, have to draw some lines. That's dysfunction, if that's the cause of it. And so thinking about, these criteria of addiction: preoccupation, withdrawal symptoms, increasing tolerance, reducer stuff, loss of outside interest, continuation despite negative consequences, lying about the use to escape adverse moods, or putting use that puts relationships at risk, opportunity offline. So anyhow, we think there's probably a continuum of this, and how much time is spent to play, but also how much it compromises overall functioning. And then at the end, you want to identify mental health professionals who are good at working with behavioral addictions. So I'm going to talk more about this case. I think we should treat as ADHD, have a motivational interview with them, get the parents on this site about common sense media, and get them. They may need family therapy. One of the issues that flares tempers so quickly is when the parents tell them to stop during and transition to something boring, like they're playing this video game, it's time for supper, it's time to go to school. And especially the ADHD kids, where it gets them in so much trouble because they have trouble attending to things, but they get so lost and engaged, and they actually, just this transition issue, even kids who are not having otherwise problem use, they don't hear the parents for the first 5 times they say it until they start screaming. And the parents have to realize that this is a transition. This is a difficult thing for the child. They have to respect that. And how to stop when they've got to get to one more level. They'll say, "Well, I can't pause now." Right? Have you heard that? So one of the things I found helpful is to there's a little gadget actually I've come to use that has it. It's a timer. So they say, okay, 2 minutes, but it's a timer, but also it flashes lights. It goes green, yellow, red, and it goes beep. So instead of seeing the person that's tearing them away from the moment they're going to get their big score on the computer, you have some kind of neutral, objective thing. So objectively dealing with transitions is so important. But then being able to think this through, not in a moment when they just got angry with them because they didn't turn it off. Having a time to meet and reflect, but please start with all the positive things and why they love it.
But there's a difference between internet addiction in a 5-year-old and internet addiction in a 15-year-old. So for a 5-year-old, we're not really doing motivational interviewing. I think it's appropriate for the parent and the doctor to say to a 5-year-old, it's not good for you, you're not getting enough sleep, or it's when you have to get off, it's causing a fight between you and your siblings or you and your parents, and therefore, as a parent, I'm going to limit your use. So I think that we want to make a distinction between smaller kids and bigger kids. And you did say that one of the most important things is prevention. Like, don't let it get to the point of an addiction by having rules about it. And so there's never going to be any internet in your bedroom. All the chargers and the devices are going to be somewhere where the child can't get them in the middle of the night. I've got patients who are getting up in the middle of the night in order to get to the devices if they're down in the living room. So they have to put them in the parent's bedroom and put them under the bed or something like that. in order to keep kids from getting back to using them. But there has to be some way of setting limits, especially for younger kids, that basically is, this isn't good for you. I wouldn't let you, use a loaded gun. I wouldn't let you drive a car till you're ready. There's going to be limits, and this is one of them.
Well, I think what you're saying, Barbara, at the very best is when they have expectations before preschool. I guess we could reveal that we said there's no TV during school nights, and they never fussed about it because it never was. We never had no electronics during school nights, and we tried to fuss. And once you let the cat out of the bag, then trying to reel it in is really difficult. So primary prevention is so important.
So another thing that I've found useful is actually using the word addiction with the kids. So kids actually know what addiction is. And if you say to them, what do you think your parents should do if they found out that you were addicted to heroin? And the kid stops in their tracks and they says, well, I hope they would help me stop. So that they can sort of relate to the idea of addiction. This isn't foreign territory, even for kids who are before teenage years. So I think that having that conversation is good. Excuse me. Another thing that I've found useful is for the stopping behavior. So sometimes it's okay for the parents. It's okay you say, okay, you can have an hour. But then the parent says, but every time we tell them to stop, he won't stop. And then we have this big fight. So I don't even want to have an hour. But for the kid, it's their lifeline socially, as you well depicted. So sometimes I say, okay, here's the deal. If you will stop when I ask you to stop, within 2 minutes of asking you to stop, then the next day, get your hour of internet or your 2 hours of internet as usual. But if you can't stop or you cause a big fuss, then tomorrow you don't get it. Because what you're building here is a skill for letting go of it, for stopping it without a fuss. And that, for many parents, that's a big part of the problem. They actually want their kid on the internet because their kid's not a problem when they're on the internet. You know, the kids with ADHD, it's a great relief when they're on the internet because they're not making any noise or destroying anything. It's the time when they have to get them to stop that's the biggest problem.
That's the transition thing, and being able to first understand that it's an issue, that they're gonna have to talk to them. They have to go eye to eye, and then I think having something objective like a timer. And I'd be glad we have it in this particular one. It's working out about $30. Has the protective lights and buzzers. People have found it useful. But that's but basically, if you don't acknowledge that it's going to be different, and you expect them to just do it to the best of parents,
right?
Down.
It's a little bit like people to stop spanking their kid. You can't just say, you've got to stop spanking your kid, because they don't have alternatives. They need help with actual strategies, and they need to know that it's not necessarily going to be easy. There's going to be a process.
I find that the most important thing when talking to parents especially is helping them recognize the importance of practicing what you preach to their children, because I think I've seen so many parents say, well, you can't use your cell phone at the dinner table, and then they themselves are checking their emails and following up with certain things on their own phones. And it's the same thing with any other behavior that we try to avoid in our children. If we tell them it's bad to curse, and yet we curse ourselves, and we tell them we can't disrespect people, and then we yell at each other in front of them, they're learning a lot more than from your actions rather than from what you're saying. So I think that has to be really emphasized among parents.
Role model.
Very nice. I agree with you.
Absolutely.
Yeah, actually, I couldn't agree with you more about that. And it's interesting, one of our colleagues in pediatrics starts her adolescent visits differently than she used to. She takes out her cell phone at the beginning of her interaction, and she turns it off. And she turns to the patient and says, you have my undivided attention. And she said that she even had one kid broke into tears when she said that, because he had so many experiences of trying to communicate with adults who actually, I think that's a nice model for that same sort of situation.
I think for us, the biggest challenge is the broader family dynamics, like their father, grandmother, people that want to gift children with electronics and technology. It's kind of hard when grandma wants to buy a 32-inch TV for the teenager's room. And so I think educating the family and the broader family on why this is not a great thing, and providing resources. That's what I really like about this talk, is that it gives you some statistics and some information to really help educate families on why they need to even have these conversations.
Excellent. Your comment about grandparents, actually the data now for obesity is that grandparents are a very large part of the cause of obesity in this country because of what they feed their grandchildren. And so even obesity, especially obesity, is a family issue, and internet is too.
I really would second and third maybe the information about how parents need to, set the example. Most of my work is with the little kids, and so our education piece is to really promote the one-on-one focus of the relationship, meaning to put the screens aside and to really promote no screens in the bedroom. But then if I were to switch gears and talk about being a parent, especially with a teenager, one of the most effective consequences that we've had is having to shut off the modem at our house so that nobody has internet. And it was something that my husband and I had to really tough it through, but that was a very effective consequence, even though it had far-reaching impact to everybody in the family. Nobody had use, but it worked, and I think you have to draw the line. So that's my anecdote.
That's excellent. That's really an excellent comment. That the router is, in most places you have to have a router to get to the internet, so that helps a lot. It doesn't help with phones that have their own connection. But it's a good way of having the whole family declare internet-free zone. I have to remember Berenstain Bears, the source of all wisdom, actually. The Berenstain Bears had a no TV week, and in the book it talks about how hard it was to give it up at first, but then how the children found things to do and the parents found things to do with the children, and it turned out to be good. That might be a good model for exactly the same sort of thing when talking to families of younger children about it.